My name is DrRic Sigil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, it's DrRic. Sal had a question about how to start up medical cannabis, medical marijuana. So for those of you who don't believe in medical marijuana, that's too bad. For those of you who are really suffering, I'll give you this little tidbit of how to go about trying to select out of the dispensary's menu. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. I do videos for a host of different medical diseases or questions of the day. This just happens to be Sal's question. Actually, other people had the same question as far as how to use this stuff. So the bottom line, though, is that the cannabis, I think, is a little bit more potent, not a little bit, is a lot more potent than hemp. Hemp is good, especially if you want to keep it pure or you don't fit the criteria, one of the 40 different criteria that'll get you certified, or if you don't use or have a prescription for a narcotic. If you don't have any of that stuff, you can't really get certified until the state legalizes medical marijuana. So that's where we go with hemp. And I think there are some patients who do okay with hemp. But for some big diseases, I think you got to go for the big guns. So the big guns usually come from a dispensary. Now, the way it works, though, is that medical marijuana can be in a flower. And then after that, it can be in the oil that you vape. Then after that, it can be in the oil that you eat. Usually that's called RSO oil, Rick Stevens oil. Then it can be in a syrup that you also put under your tongue. Then it can be in an edible. That can be in a baked product that's already provided, or a gummy. And then it can be in a topical. And I'm sure sooner or later it's going to be available in a snort or a nasal spray. That's my idea. So anyway, and topicals can range from creams to oils to patches too. And then out of all these things you have THC and CBD. So THC and CBD, those are two cannabinoids that are the most active ingredients in your medical marijuana. The CBD portion is what I usually try to get my patients with inflammation, chronic pain, arthritis, fibromyalgia, rheumatoid arthritis, Crohn's disease. I try to get them to max on that because the CBD, if taken on a regular basis, and it's usually going to be, I'd like to have CBD, a maximum CBD, and it's hard to separate the two because the plant has both. Hemp, on the other hand, it just has CBD. It has a fraction of THC in it, so for all intents and purposes, hemp is just CBD. And medical cannabis is THC and CBD. Those are the two things. So the bottom line is I usually will say, if we have an inflammation issue of any sort, even cancer, I'd go for getting CBD in first for the first month. Usually it's 1 week at a time, same dose, every time. And if we're going to do oral, that's the oil, the syrup, the edible, I try to do 3 times a day dose, watching out that you don't get too drowsy with the THC part. So if you're getting tipsy, if you're getting dizzy, if you're sleeping all day, or if you're just too high, that's too much THC. CBD at the right dose, you shouldn't even notice it. But because you don't notice it, except for maybe greater range tolerance and range of motion, less pain relief. Less need for pain relievers like Norco, Vicodin, hydrocodone, Tylenol with codeine, Tramadol. Once you can cut back on that, then you know the CBD is working. It's not just coincidence. So I usually say 3 times a day on one of these things. And then you stick with that. After about 7 days, if you don't notice anything, then you crank up the dose of the RSO oil, the syrup, or the edible. So the problem is, as you go from flower all the way to topical, you process the leaf, the flower, and the more you process it, as like anything else, the more expensive it is. So this stuff is really easy to use, but it is super expensive. Edible gummies, which are supposed to be taken sometimes 1-3 times a day, can be $40 for 10. So if you cut them up into 4, I think for an older person that's okay if you can get to a good level. The idea is to get to steady state. If you have the product absorbed properly, assuming that you have a healthy gut, then I would assume that after 7 days, if you don't change anything else, and that's important, don't change anything else when we're starting on this. Because if you do this, introduce this, and then you get a massage, you're not going to know if it's the massage that gave you and the essential oil the massage therapist used, or is it because of this? You're not going to want to start a new diet because you're not going to know. Is it that, or you're not going to want to go on vacation? All those things have to be kept to a minimum. Try not to have too many variables. So 3 times a day for about a week, 1 dose, highest possible CBD. It's a ratio. So you get the highest possible CBD and the lowest possible THC. I think THC is still helpful even for inflammation because it accelerates the CBD. So it accelerates the potency of the CBD. So again, it's hard to separate the two, but if you get highest possible CBD, like for example, if CBD is 10 and then THC content is 1, that's a pretty cool potency. So that's what I would do 3 times a day. You can start out at twice a day. I usually say 3 times a day. 3 times a day with one of the components, and you see how it goes. If you don't get any response and you up the dose, you can either double it or add more. Just notice how much you use. For another 7 days, no other changes. And you keep on upping the dose until either you start to get too high or start to get the THC effects, or you've maxed out and you ran out of the product. At that point in time, you want to switch to a different product. Sometimes oils versus syrups versus edibles, they'll react differently. They always have to go through the gut, so that after it gets absorbed in the stomach, there are active ingredients that get released into the bloodstream. And then it has to go through the liver, and the liver breaks it down into more other components that sometimes are just as powerful. So you might have this second effect after the liver digests the first hit. So that's why it's important to do 3 times a day. That's what I would do. And if you happen to be either having PTSD or an anxiety issue or insomnia, then we're going to be using the THC, but you don't want to do them together. So, as I said, THC is always an accelerant to the CBD. That's what I think of it. So once we get to steady state and you notice improvement in pain, you just keep on plugging away and keep on with that same dose for about a month to 3 months. But once we know about the response, then we work on your sleep. Most people with pain or inflammation have a sleeping problem. Now, if you're just doing this for PTSD, that's totally different. I would go with flower or vape first because it's a faster hit. But we just stick with the inflammation part. So once you know what to do with the inflammation part, you've dialed up and you've maximized on 3 times a day dosing, you keep that steady, then you add in something for sleep. And sleep usually has to be something that hits fast and goes away fast. And I think that's going to be either the smoking of the flower or smoking the vape. Now, the flower is the cheapest, but it also is the most profuse as far as smell. If you have kids at home, I don't know if I'd want them smelling that because they'll know what you're doing. They always do. You can't disguise it with incense or anything. I mean, I use incense in here, but I'm not smoking it here. So I've heard stories where parents, I think my parents too, did that and they thought we didn't smell anything, but you definitely know about it. And then that makes a young person wonder, should I try it too? So I try to stay away from that. Vaping, I think, is less profuse. So whatever it is, whether it's a flower or vape, sometimes you can get a volcano too, and that just burns it at, I forget what the Kelvin temperature is, so it disintegrates everything and you get the essence of the hit, but that's mostly for nighttime. So hopefully you can dial in which high dose THC, usually indica. That indica is the species of the plant, or the subspecies of the plant, and the indica seems to make people relax, whereas sativa seems to make people awake. So if you want to use it to help the arthritis pain and get good sleep, because arthritis usually knocks you out of sleep because you wake up with pain, then once you dial in the inflammation control, 3 times a day, you add on the vape or the flower smoke. And you do that every night for about 7 days or 7 nights, in addition to your usual dose that you dialed in, and you see if it helps you with sleep. Or you see if it actually accelerated the strength, the potency of your daytime 3 times a dayer. And if it did any of those things, then it works, and you keep up with that routine. Hopefully you can experiment with this and not spend too much money. But that is my usual. And then once you know the 3-time-a-day routine, like you're using this like a medicine, like an anti-inflammatory, and you know your nighttime rescue to get good sleep and not wake up groggy, then sometimes you'll need a rescue during the day. And if you don't want to take the syrup during the day, you don't want to take the vape or the smoke and flower during the day, that's when you get a topical. And you just paint it on the hands or your areas of tenderness. The trigger point, I used the trigger point in Colorado once, Mary's Medicinals, awesome stuff. Except I made a mistake of experimenting and using it all over, and that has menthol, so it evaporates and cools. My whole body was cold, and that was in Colorado during a snowstorm. Wasn't a good feeling. But if you just use it to the worst spots, you can use that as a touch-up during the day, in addition to your other things that you're using, just as a touch-up. Nice to have on vacation or if you're just recovering from delayed onset muscle soreness. So that's how I would do it for inflammation. Now, for my guys that are trying to beat post-traumatic stress disorder, then really it's just going to be finding the right THC, the fastest response. The only problem with, again, vaping or smoking the flower is you can use it for nighttime because you're in the privacy of your own house. But what do you do during the day? If you can get to a private area that has a fan or is outdoors, you can probably vape if you get claustrophobic or some stress and you need to calm down instead of taking a Xanax. And this is less addicting than Xanax or any benzodiazepine, so I think it's really, I highly suggest it more so than those things. Especially if you're taking benzodiazepines for sleeping, that really just screws up your sleep. I think it does get you to sleep if you're an anxious sleeper, but it also robs REM, and you need REM to feel refreshed in the morning, so you're setting yourself up for a dependency issue. So again, it's going to be finding your indica and or finding your vapor flower. Once you know what to do, if you have PTSD, you use that for every night. And if you need something during the day, you can try to get away with a vape, or you can try to get away with one of these guys. If you're using the flower vape every single night for your PTSD sleep, then sometimes the little touch-up with a syrup or an RSO oil or an edible during the day will make this last or bring it out. Maybe it'll make it last a little longer. You'll have the traces of the effect probably in the morning, but you might have to find an RSO syrup or an edible that's higher in THC than CBD. Remember, CBD is for inflammation, THC is more for calming. Now, both of them accelerate each other, so they help each other, but that's basically what I use for my PTSD patients. So you don't want to be, whether you're taking care of inflammation or whether you're taking care of post-traumatic stress disorder, I thought that would be a nice way to separate, you still don't want to be walking around dope. You don't want to be high. You don't want to be sleeping all day. You don't want to be reading the same page for 3 hours. So that's too much. That's Cheech and Chong much. And that brings me to my last point. I don't have a problem with recreational use of marijuana, but I do have a problem if you're self-medicating. So, and some of you might not agree with this, but self-medication for light disorders or light disease that's not too obtrusive to your activities of daily living, your work, your family life, your social, probably okay. If you're using it every single day, non-medicinally, then you really should take care of the root cause. The idea, this is medicine, and if you don't take care or address the root cause of your disease process, you're just taking another medicine that has less side effects than prescription medicine, which is good, but you still haven't addressed the root cause. You still need psychology. You still need physical. So if you're a PTSD sufferer, you still need psychology, whether it's cognitive behavioral therapy or calming practice, mindful practice, guided imagery, you still need something. Even the best meditators still need a coach to make sure they're on target. If you have an inflammation issue or a gut issue, you still need a nutritionist or you need a physical therapist to touch base with to push you past the point, especially if you have the medicine started already. You want to be able to push you past the point of having pain or having disability. And hopefully this can get you to control a bit, and you can use your coaches to accelerate so you might not even need this medicine. So hopefully this helps, Sal. If you have any questions on how you use it or statements on how you guys use this, that'd be great. Just leave them in comments down below. And otherwise, I'll see you at the next Minute Clinic.